Hello, differential diagnosis team and differential diagnosis students. This is Dr. Kamel, and we will have a series of NBT style questions related to differential diagnosis. We will present the question, and then we will present the answer, and then I will try to explain why this answer is correct, why this answer is incorrect. So please look forward for a series of questions. As a matter of fact, that the lecture time is limited, so we cannot discuss this question in the lecture. The same thing for the lab time. So that's why I will try to post these questions for you as short videos and recording. So the question for today saying a 34-year-old male patient recently admitted to an acute care hospital is referred to physical therapy. The physical therapist documents the following clinical signs: pallor, cyanosis, and cool skin. These clinical signs are most consistent with which of the following conditions? And we have four options here: cor pulmonale, anemia, hypertension, and diaphoresis. Okay, so this patient is pretty young. He was admitted to an acute care hospital and then referred to physical therapist. The physical therapist, during the evaluation, he or she finds out that the patient has pale skin, okay, cyanosis, which is abnormal discoloration, like bluish discoloration, and cool skin, so the skin temperature is abnormal. These clinical signs are most consistent with which of the following conditions: cor pulmonale, which is right side heart hypertension or increased pressure of the right side of the heart, anemia, hypertension like systematic hypertension. Okay, so cor pulmonale basically is increased pressure but related to pulmonary causes, or diaphoresis, which is excessive sweating. And which one is the correct answer here? Okay. So remember, when we talked in the first lecture for screening or medical screening, we said that the patient might be referred for something like low back pain, like knee pain, anything like that, musculoskeletal or neuromuscular problem, but the patient is showing some signs and symptoms which are abnormal and might need referral. So which one of these is the answer, you think? And the correct answer is anemia. Okay, so what is anemia? Anemia refers to a decrease in the number of red blood cells, okay, that carry oxygen in the blood, resulting in a variety of symptoms, including pallor, cyanosis, cool skin, vertigo, weakness, headache, and malaise. So this is the correct answer. And anemia, is the most common disorder of the blood. So many people have anemia, especially in females more than males, especially with repeated pregnancy, menstruation, and so on. The three clinical categories of anemia include excessive blood loss, so like hemorrhage, excessive blood cell destruction, somebody who have a disorder related to blood like hemolysis, or deficient red blood cell production, like a problem with hematopoiesis, or the formation and production of red blood cell. So that's why this is a correct answer. Let's go for the incorrect answer. Cor pulmonale is a right side heart failure arising from disease of the lung, as I have explained. What are the signs of right ventricular failure or right side heart failure? Elevated central venous pressure, this is number one, with distension of the neck veins and shortness of breath. Okay, ascites, which is accumulation of fluid in the peritoneal cavity, okay, in the abdomen, and also peripheral edema of the feet and ankles. These are the common signs and symptoms. Those people with heart failure often experience fatigue and exercise intolerance. Why answer number 3 is not correct? Hypertension is abnormally high blood pressure, you know. We have different stages for high blood pressure, like stage 1 hypertension, stage 2 hypertension, and hypertensive crisis. Hypertension often goes unrecognized. Sometimes they call it the silent killer. Some people they have high blood pressure and they don't know. And especially with those who have mild or moderate elevations in blood pressure. Usually they don't have symptoms like headache, like blurring of vision, or so they don't recognize that they have high blood pressure. Okay. Why number 4 is not the correct answer? Diaphoresis. Diaphoresis refers to profuse perspiration or sweating and is often associated with shock or other emergent medical conditions. So the correct answer here is number 2, anemia. And thank you for listening, and I will see you soon in another question. Thank you.